speak for our webinars. Just as a reminder to all of you, if you have any questions, please feel free to write those in the Q&A box that you have at the bottom of your screen, and we'll be addressing those at the end of the session. Now, simply prior to beginning our presentation, we would like to do a short poll, which you should see on your screen now, just so that we get to know you a little bit better. So let's take about a minute or so to have you answer the questions that you see on the screen before we give Dr. Kaur the floor. Right now, we have about a quarter of attendees who've already replied to the poll questions. Gender-wise, we're pretty balanced. We've got 43% female, 50% male. Most of our audience is between the ages of 40 and 50, 33%, with the other 32% being below the age of 30. Most participants, and this is very nice for us to see, is from the region of South Asia, at 40%, with about 36% from Africa and the Middle East. Let's say the highest, most of our participants have pharmacy masters or PhDs at 19%, or otherwise in public health at 15%. With over 15 years of experience, that's 44% of our participants, and most of them are either in national government or in the private sector, working in the areas of technology management and clinical support. So thank you to all of you. We now have about 70% of all of you who responded. Thank you for sharing this information with us. And Dr. Kaur, whenever you're ready, you may have the floor.
Sure. Thank you so much, Daniel. I hope I'm audible.
Yes, we hear you well. Thank you.
Yeah, okay, thank you. So thank you everyone for joining the webinar. So this webinar is basically for how digital health is transforming the healthcare sector in Asia. So to begin with, I'll take you through the table of content. So these are the major topics that we'll be going through in today's webinar. First is introduction to digital health. Next, we look at how healthcare is getting transformed in Asia. Then we will have case studies, the overview of the various domains of digital health and what impact they have in digital health across various countries and various regions in Asia. And at last, we'll talk about empowers PGD in digital health. So here I would like to emphasize that we have tried to cover different countries across Asia for each of the digital health domain, so as to map the maximum region that we can. Also, while taking examples or case studies, we have tried to integrate different healthcare scenarios for this. So not just, we have covered maternal health, geriatric health, cancer. So we have tried to cover all the domains where digital health has shown its impact in transforming the healthcare scenario in Asia. So moving on to the next slide. So let's begin with the basics. So let's discuss about what is digital health. So as per the World Health Organization, digital health is the field of knowledge and practice, which is associated with the development and use of digital technologies in order to improve health. Digital health further expands the concept of e-health or electronic health to include the digital consumers with a wider range of smart devices and connected equipment. So some of the examples of digital health components that you can also see here on screen are electronic health records or EHRs, mHealth, which is mobile health, telemedicine, artificial intelligence, and many more. There are many more domains of digital health, but we'll be focusing on these four across Asia today. Now let's shift on focus on how digital health is transforming healthcare in Asia, how it is moving forward, though there are challenges in the region. And then let's look at what the current status of health is in Asia right now. So Asia's healthcare landscape is on the verge of a significant transformation. And this is mainly pushed by five key forces, which is driving both urgency and innovation. So if we look at number one for aging population, so it is estimated that by end of this year, which is 2025, Asia will have over 450 million people, who will be of ages 65 years and above. And this would account for nearly 10% of the whole region's population. So this demographic shift increases the demand for healthcare services. While you know that there are already lesser available healthcare workforce, thus it puts a lot of pressure on the healthcare delivery system. Number two is healthcare workforce and supply constraints. So most of the Asian countries, they have few doctors and nurses per capita than other developed nations. And the region is significantly also impacted by a shortage of global, presence of nurses. So traditional and labor intensive care models are no longer sustainable here. So this further highlights the need for a scalable and tech-enabled solution, which can ultimately enhance the health and well-being of populations. So now moving on to the third point, which is rising consumer expectations. So we all know that, the individuals or the people these days have become very health conscious. So across Asia also, people are spending more on their wellness, on their nutrition and healthcare products. There is a growing demand for accessible, affordable, and high quality care, which is driven by increased health awareness, especially, after the pandemic has had an impact. Next is increasing financial burden. So despite, of accounting for most of the healthcare spending, Asian governments invest only 4.5% of their gross domestic product, which is really very less if you compare it to other OECD countries. So balancing healthcare needs with financial sustainability, it requires an urgent public policy change. The fifth one is technological innovation. So we all know that Asia is a global leader in digital innovation. With nearly half of the world's internet users and growing venture capital investment in digital health. So this momentum is accelerating the adoption of tech-driven healthcare models, which are scalable, which are data-driven, and which are patient-centric. So in light of these evolving trends, Asia is witnessing rapid emergence of consumer-focused digital health ecosystems at a very high pace and at a big magnitude as well. So currently, digital health solutions impact the life of over 1 billion people, and the projections suggest that by 2025, the digital health sector in Asia could generate up to $100 billion in value. So if you also look at this table, you can see there are categories of wellness, of screening and diagnostic, and of care delivery. And if you see how the value pool for it is, the wellness and disease prevention, therefore improving wellness, preventing diseases. And example of wellness of these categories are wearable devices that we use every day, or activity trackers, or fitness trackers. So in 2020, their market size was 2.3 billion. However, in 25, it is projected to be around 6.6 billion. You can see the significant increases here. Then even for screening and diagnostic, for intercepting diseases through screening, the market size was 3.5. And now the projection, if you see, it has gone into double digits. Now for care delivery, for identifying the right patients, for providing more effective therapies, for providing remote patient support, and for supply therapies to patients. You can see it all is seeing such a huge surge, and it is reaching up to $100 billion by end of this year. Next, now let's move forward with the health technologies that we discussed previously, and we'll be taking them across the region. So first is electronic health records. So what are electronic health records, first of all? So they are the digital versions of paper charts that contain a patient's medical history, their diagnosis, their prescription, treatment plans, their immunization data, what they are allergic to, their radiological images, laboratory tests. They are all concised into an electronic version. So how does it facilitate healthcare? So some of the applications of EHR includes centralized patient information. So EHR systems allow healthcare providers to access the comprehensive patient records from different healthcare facilities. This improves coordination as well as quality of care. For patients also, patient portals are there, and patients or end users, they can access their own records, they can view their test results, they can schedule appointment with their healthcare providers, and they can communicate with their healthcare providers. So now let's look at some of the country-specific examples for this. Although, like I've also told in the beginning that we'll be looking at specific examples, although a lot of countries across Asia have integrated EHRs, but because we wanted to integrate maximum regions into this, we'll be taking 2 countries per domain thus. So for EHR, if we look at South Korea, you can see the adoption of electronic health record system is really remarkable. It is 96% in hospitals and 95% in the clinics. So most of these healthcare facilities also enjoy high rates of health information exchange within their organization. So this widespread integration of digital tools, it has positioned Korea as a global leader in healthcare ICT. And it is also outperforming many countries in the European Union. Now, the second example here is of Saudi Arabia. So as per their Vision 2030, they have a strategic plan to diversify the economy and raise living standards. So a key milestone here is also integration of electronic health records into clinical practice. And this digital shift has been a game changer for them. So, by digitizing patient data and enabling easy access to medical records across healthcare settings, EHRs have revolutionized Saudi Arabia's healthcare infrastructure. So what is the impact of EHR? So integrating digital health systems such as electronic health records. So first of all, there is improved continuity of care and stronger referral systems. Next, clinical decision support systems are also there, which have empowered the providers, and thus they can make faster and smarter decisions. And third, we also have now enhanced population level analytics, which makes the disease forecasting even more accurate and proactive than ever before. So next we'll move to mHealth. Now, what is mHealth? So mHealth refers to the use of mobile devices such as smartphones, tablets, and wearable devices. I'm sure many of you must be using mHealth apps, and you must be using your smartwatches to monitor your health. So these all fall under the category of mHealth. So again, some of the applications for it includes mobile apps for fitness tracking, for medication reminders, for chronic disease management, and wearable devices like smartwatches that can monitor your heart rate, your activity level, the number of steps you have taken, your sleep patterns. So mHealth apps can be used at a diverse places regarding the healthcare delivery. So now let's look at some of the real life examples for how mHealth has enhanced healthcare across Asia. So let's look at Sri Lanka first. So Sri Lanka has battled with dengue epidemic in the past. So there were recurring dengue epidemics in Sri Lanka. So again, this was a challenge, but then again, digital health innovation emerged here. So with a strong motivation to adopt mobile-based tool, Sri Lanka developed MOBUS, which was a smart and mobile-based system that brought together digital surveillance, disease mapping, and dengue education all in one platform. So Mobus was also created using the spiral model of software development, which is an collaborative iterative development approach. And later it was adopted by more than 50 public health inspectors in the Colombo Municipal Council system. So this shows the success of the mHealth apps here in this scenario. Now let's look at Japan. So with you, we all know that Japan is one of the countries with the highest life expectancies in the world. Again, because of this, the country faces a growing need for accessible and efficient healthcare services. Again, there is a shortage of medical specialists, and there is a need for streamlined healthcare delivery in the underserved region. So all these also pose a challenge in the healthcare delivery. So here also, mHealth interventions, they offer convenient options for remote monitoring, for virtual consultations, and this is especially vital in elderly care, where consistent at home health management is very crucial. So the outcomes of embracing mHealth in healthcare system. So firstly, it has led to higher medication adherence and health literacy among the patients. Next, digital health interventions, they not only improve access to specialized care, but it also streamlines healthcare delivery in that region. Finally, it has significantly improved disease monitoring, follow-ups, and ensuring long-term health outcomes for the patients. So the next technology for deliberation is telemedicine. So what is telemedicine? It is actually a subset of telehealth. And this specifically involves clinical services which are provided remotely, including remote diagnosis, treatment, and monitoring. So usage of telemedicine includes remote diagnostics, where doctors use telemedicine tools to diagnose and treat conditions by analyzing the patient reported symptoms and the report examination of data. Then there is also telesurgery, where surgeons can perform minimally invasive procedures using robotic system control from a distance, thus allowing access to expertise regardless of their geographic location. Now, let's look at some of the examples of telemedicine. So the first one is from Vietnam. So what happened was that during COVID-19 pandemic, we all know that telemedicine emerged as a powerful symbol of modern healthcare technology. So the government here, they launched a visionary project to connect 1,000 hospitals with the aim to enhance the quality of care across the country. So by leveraging the expertise of central hospitals and by enabling provincial hospitals to support rural areas, this initiative bridged critical gaps in the service delivery. Even at their hospitals, the Futo General Hospital, telemedicine proved to be feasible. It was widely accepted and highly effective, which ultimately led to significant improvements in healthcare outcomes. Next example is from Mongolia. With a so what is in Mongolia? So Mongolia has a very low population density with just 2 people per square kilometer. So delivering healthcare services to remote areas present a major challenge. But then again, Mongolia turned to technology for solutions. So through telemedicine interventions like teleconsultations and internet-based diagnostics, telesurgeries, and even tele-education courses via their Tele-Cyber Academy, the country has built healthcare capacity in rural regions. These innovations are bridging distances and enabling the delivery of quality health services across the vast and sparsely populated landscapes. So integrating telemedicine has been significant. So what is the impact of it? So it has reduced the need of patient transfers, and it has helped ease the overload on the urban healthcare systems. Most importantly, it has enhanced access to specialty care. It has led to better health outcomes for rural and vulnerable populations. And it is very paramount in closing the healthcare gaps and ensuring equitable healthcare for all. So the last technology that we will be talking about today is artificial intelligence or AI. So what is artificial intelligence? It involves machines simulating human intelligence processes, including learning, reasoning, and self-correction. So some of the examples include chatbots like AI-powered chatbots assist patients in assessing symptoms and providing the initial suggestions for it, and they can direct them to the appropriate care. Next is image analysis. AI-powered systems can interpret medical images like X-rays or MRIs to assist the radiologists in identifying anomalies or diseases. Now let's look at some of the examples where it has been integrated. So first example is of India. So this study is from a recent review article that depicted the role of artificial intelligence in revolutionizing maternal health. So we all know that maternal health continues to be a major challenge with disparities in access and quality of care, thus leading to high rates of maternal mortality and morbidity. But again, there is hope. AI is stepping as a powerful ally, from enhancing diagnostic accuracy to improving patient monitoring and broadening access to essential services. AI is transforming how we address maternal health challenges head on. It was also noted that AI-enabled telemedicine and virtual assistants are bridging healthcare gaps, particularly in underserved and rural areas, thus improving the accessibility for women who might otherwise face challenges to or they might have not get the quality maternal care. Next example is UAE. So now we'll be talking about NCD, which is cancer. So we all know that cancer poses a major health challenge globally. The burden of cancer in UAE is significant as well. It ranks as the second leading cause of NCD-related mortality in the country. UAE has taken bold steps, leading the region in adopting to cutting-edge technologies, especially AI in cancer care. So today, multiple AI platforms are being deployed, particularly for breast and lung cancer screening, which use advanced imaging to support early and accurate diagnosis. So the future of cancer care in UAE is truly getting reshaped by technology. So regarding the benefits of AI in disease management, so it is pretty clear. It has reduced the time for diagnosis. It is allowing patients to receive care on a timely manner. They receive care much faster. It has also increased accuracy in detecting cancers and other NCDs. It is improving early intervention, and more importantly, AI is also helping optimize clinical staff workloads, thus reducing the burnout of the staff and enabling healthcare professionals to focus more on patient care. So we have all seen, what digital health is till now and how various domains of digital health are transforming the healthcare across Asia. So in current context, it becomes very essential to have the digital health skills. So, this is where Empower School of Health helps you. So Empower is right now offering a unique training program to upskill the learners in domain of digital health. This online program has been developed in collaboration with UNITAR, and our course empowers you with the knowledge which is required to navigate, the domain of digital health, the technology. This program is pretty affordable and accessible and is tailored for professionals in diverse settings. So although we have already discussed this, that why digital health skills are essential, but then again, we are providing you evidence for this as well. So you can see from this graph that the market cap for global digital health market is estimated right now at $427 billion. However, by 2032, it is expected to grow to over $1 trillion, which is huge. So digital health is certainly a lucrative and growing field, which offers numerous opportunities for you to grow as a professional. So here are some of the highlights of our program. So our program is an online course which is supported or complemented by regular live expert sessions to enhance the learning of the students. The curriculum for this course is crafted by industry experts and senior academics in the domain of digital health. You can also get access to the latest books and reading materials from the well-known authors and publishers in this course. We also have live interactive sessions with experienced subject matter experts. We also offer a 3 months internship with UNITAR, and we also provide mentorship from the Empower faculty and industry professionals. Next, so what is in our course for you, as learners, as students, what will you get? So you will receive a recognized certificate from UNITAR and Empower on completion of this course. You will have the opportunity to learn from experts from diverse domains of digital health. So we have experts who talk about digital health innovations. We have experts who talk about global health strategy, about health informatics, about various domains of digital health. You will engage with valuable content through our webinars, our discussion boards, which are there specifically for our students. You will get access to excellent reading materials. You will get book PDFs relevant to the certain chapters when you go through our course. You will, our course is not kind of in a siloed kind of thing. Our course has a global orientation, which is really helpful in broadening your perspective. So you can also benefit from using the cutting edge learning technologies and instructional design, which is used in this course. We also have a robust assessment system, which includes report writing, case studies to enhance the learning of our students. And you can also discover diverse career paths and opportunities that are present in the rapidly growing field of digital health. So our course equips professionals at all levels. So if you are a leader, a manager, or even an early career entrant, our course will provide you with the skills to thrive in diverse domains of digital health so that you can shape the future of healthcare. So this slide right now, it represents the various career opportunities that are present for digital health right now. So why wait? Let's transform healthcare today. It is really important to develop the digital health competencies right now. You have also seen the graphs depicting the growth of the market. So as a learner, you need to equip yourself with the knowledge, with the skills with which you can navigate through this field. So, if you are really passionate about transforming healthcare through technology, through digital health, so this is the perfect time to embark on this journey and learn about digital health. So regarding the enrollment process, it is very simple. You just have to go to our website. I'm sure my team must have posted the links in the chat box. So just go to our website, and in the courses section, you can find about postgraduate diploma in digital health. As soon as you click on I'm interested, this kind of a pop-up form will come up, and you can fill in this form and submit, and our team will get in touch with you. So regarding fee structure, this is the fees of the course right now. And we have 4 enrollment cycles throughout the year. And admissions for the next session are open right now. So I would encourage you to go and check that link and apply for the course. So what will you get in this? You will get an official postgraduate diploma certificate. What is, in this cost, what all is included is what I'm talking about right now. A certificate, then e-tutoring and case study mentoring, the exam fees, case study evaluation, 12 months of technical support on a digital health topic, which is related to your work in this course, internships and life project opportunities with leading organization for top performing students. So we also have a financial planning option for our students. So you can pay the fee in 6 equal installments within 8 months of commencement of this course. We also provide 10 to 20% scholarship for eligible students. And this eligibility criteria for financial aid for scholarship is on a first come and first serve basis. You can talk to our course coordinator to find more about scholarships. I'm sure my team must be posting the email IDs of the relevant people with which they can get in touch with. So for more detailed information, please, you can go to our website and look into it. And this is for the email ID of our operations team, wherein you can go and send an email to them. So that was all in the presentation today. Thank you so much. And I would now like to, take up the Q&A session in case anyone has any queries. Please ask the questions.
Well, thank you very much, first of all, dear Dr. Kaur, for this highly insightful presentation and for talking about this very exciting joint diploma that we offer between UNITAR and Empower School of Health.
Yeah.
We noticed earlier in the webinar that most of our participants come from South Asia. I'm actually holding in my hand a document, as you can see, that shows just how relevant these courses are to South Asia, because indeed we did our best to make sure that all the courses provided by Empower School of Health correspond to Asia's pharmaceutical regulatory framework, as well as their digital master plan for 2025. So do trust us when we say that these are not only important but relevant to your needs. And yes, indeed, let's take about 5 minutes to answer any questions that you may have written in the Q&A section.
Yeah, so Daniel, before we move ahead with the Q&A session, there is another announcement that I would like to make. So, we recently celebrated Nursing Day. So we have a special offer for all the nurses out there who want to enroll for our digital health course. There is a special discount of 25% going on right now. So if there are nurses in the audience, or the audience has anyone who knows someone of their friends are nurses or anything like that, I would really encourage them to come and take up this course. So please visit our website again for the same.
Thank you. And I can see that your team has indeed shared the relevant information in the chat. Yeah, well, while we're also waiting for some people to share their questions in the Q&A section, perhaps we can also launch the second poll.
Sure.
That will give us enough time to perhaps gather some questions from the participants. Okay, while we're gathering the answers, Dr. Kaur, for the poll, we already have our first question from Pharaoh Chaire, who's asking, how acceptable is telemedicine in Asia, and in terms of costs to patients, is there reduced costs?
Yeah, thank you, Daniel. So regarding this question, like I've already shared the example of telemedicine, how it is integrated so well in Asian countries. So telemedicine is quite acceptable in Asia. And in terms of cost to patients, of course, there are reduced cost, what is teleconsultation? Like you and I are right now talking on screen. So this is how you talk to your healthcare providers. You don't have to travel to the place of, where your healthcare provider is. You also save on the time for what, you have to go and wait in long lines there. So of course, the costs are reduced. Telemedicine is very accessible and affordable. So it is pretty acceptable in Asia. A lot of countries have integrated telemedicine into their healthcare system.
Thank you very much. We currently have 42% of our participants who responded, none of whom have said that they didn't find this information useful. So congratulations to you for keeping a clean record as always, Dr. Kaur. 86% of our participants say that they are interested in exploring health courses, and that mainly they are interested in topics like digital health technologies and innovation, leadership, policy, and governance in digital health, and a master's in digital health. The most popular, say, duration of a course would be 2-month online certificate or a 12-month PGD. And most of our participants are looking to grow within their own organization. And the reason why they attended this webinar is to learn more about new trends in digital health, which I think is definitely something that's been achieved thanks to your insightful presentation. So we'll be ending the poll, and let's see if there's any more questions. So this is from the same person who's asking, if anything goes wrong to the patient, who is responsible when sued by the patients? I guess that's in reference to telemedicine.
Yeah. So what happens during teleconsultations is that, if based on what patient is reporting to the healthcare provider, if there is something serious, then of course they are called to the healthcare facilities for detailed examinations. So telemedicine does not work like, that doctor will give advice and not look into the details of what the patient is offering. Of course, even well teleconsulting, the reports are very important. The doctors will ask you if you have done your blood test or if any reports are there to share with the provider. So based on all these evidence and facts, maybe, if doctor thinks they can consult you over the call, they will consult. Otherwise, what would happen is that they will call you to the facility to corroborate, your findings with the results, with the reports. So this is how it works generally.
Thank you very much. So far we have no further questions. So we hope to see all of you, dear participants, already as perhaps students in this exciting postgraduate diploma that's been shared by Dr. Tower. And in the meantime, we wish you all a fantastic day.
Thank you. So if no more further questions, I think we can close this then. So thank you everyone for coming to the session and for the questions that you have posted. Thank you for showing interest, and we'll be actually looking forward. If you have any questions, you can always reach out to the team, and we'll surely try to answer all of your queries.
Have a good day, everybody.
Thank you.